Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Eye on the Lowcountry, sponsored by Dr. Michael Johnson with Retina Consultants of Charleston.
Joining us today, we have Dr. Michael Johnson. He is a retina surgeon here at the Retina Consultants of Charleston. Thanks for having us today. All right, I'm super excited about this topic because we're talking about the differences between specialties and things. Like you have optometry, ophthalmology, and then
opticians.
Optician. So we got all different areas.
The nomenclature is very confusing.
Okay, so explain like where you fit in that little equation.
Sure. So there's a variety of eye care professionals, and they all do something a little bit different. We all work together as a team, and we refer patients back and forth, and we just partner to get the absolute best outcome for our patients, because we all provide something unique. And the first type that you should be aware of is an optician. Now, an optician doesn't do eye exams. They simply make the lenses and the spectacles in your glasses. And that's what they do.
So they're like the craftsmen?
Yeah, they're like the craftsmen, exactly. They make the glasses.
Okay.
And then the next group are optometrists. And they do eye exams, and they figure out what power your glasses should be or your contacts should be, and they write those prescriptions. They give it to an optician who then makes them. But they are super skilled, and they provide comprehensive eye exams, they make diagnosis, and make treatment recommendations. And this, I've gone out and met a lot of them in this area. In Charleston, we're just blessed. It's an embarrassment of riches. We have fantastic talent out there, very talented and dedicated eye care professionals. And then the last type of professional is the kind I am. And these are physicians or surgeons who then decide after they've gone to medical school to specialize in eyes.
Gotcha. So I'm thinking, I always like to make like sports analogies. So like I played soccer, so you kind of have like one at midfield, the other, defense, and then you're like the goalie.
Well,
like, so
I
if
suppose.
they make it or something, they make it.
I like it. I'll be the goalie. I'll take it.
Yeah. So so if they make it to you, so you're getting the referrals, correct?
Right. So I get referred to commonly to treat complicated medical and surgical conditions of the retina, just a little part of the eye.
So when they're doing all these little things, when they're testing your eyes, are they able to see that there's a retina issue?
Yes. So optometrists are fantastic about making diagnoses, and they have very high-tech equipment, and they're very skilled, and they have a lot of training. And so they do a wonderful job, and then they refer them to me, and I fix them. And that's sort of how it works. But they also do treatments, they also do other things, but I tend to get complicated stuff.
So it's important though to get those eye exams though.
Yeah, so it's sort of all hands on deck, because both the two most common causes of blindness are retina conditions, and they're epidemic in South Carolina and the United States: diabetes and macular degeneration. So people just don't come in enough, and so things are brewing in their eyes and they don't realize it, and they come in too late. So the optometrists help us. It's like all hands on deck. We need to get them to the optometrist. If you're diabetic, be seen every year. If you're older than 50, you need to be screened for macular degeneration. And so we all work together. And I screen patients too. We all do. We all work together. We all have our strengths.
So it's not like it was, where it's like something that's inevitable. Like you can actually change the course of someone's life, correct?
Yeah, we can do amazing things nowadays with the amazing technologies. It's a very dynamic field these days. It's part of the neurosciences, retina, and it's where all the action. There's so many great things that we can do. So we can usually help about 90% of our patients, which is tremendous. In 2002, 2003, for macular degeneration, we can only help 10% of our patients. Now, fast forward, 90% can be helped.
How rewarding is that?
Yeah, it's very gratifying, it's very exciting, it's a very dynamic field.
Okay, so I hope this doesn't gross me out, but I'm thinking, like, how do you actually perform surgery? How does that work? Like, how do you operate on it?
Right, well, retina surgery was called vitrectomy, and it's the original endoscopic surgery. Basically, retina specialists in 1971 invented endoscopic surgery, and then it's sort of been spread to other organ systems and other specialties.
So you're talking about like when you said endoscopic, that's like, like getting gas.
So right, there are little safe places
stuff
in the eye, if I can, and it's an area that has a technical name called the pars plana, but it's this pink area, and we can go through that area to access the back of the eye. And we use instruments that are so tiny, they're about as thick in diameter as an eyelash. And we can go in and do unbelievably delicate and intricate things to take care of this complex organ, the retina. And so it's phenomenal technology. And you know, patients recover rapidly, and they do very well. They take hardly any pain medicines. Most people take nothing, maybe Tylenol. It's done under local anesthesia. So it's kind of a small miracle what we can do.
Are you awake?
They're awake. We talk to them, we make jokes with them while they're operating on them. It's actually a pleasurable experience. And there's just so much we can do. It's very exciting for us and the patients.
Okay, so like there's not, you know, I heard you making this joke earlier where you're not like taking out people's.
You know, everyone thinks we take the eye out.
Yeah.
You know, and so I tell them, yeah, we take it out, we put it in a golf ball washer, clean it off a little bit, and we pop it back in. But no, there's no need for that. So we can access it in the eye socket.
All right, so if anyone were, you know, if you're just trying to simplify what your role is when it comes to the health and well-being of people's eyes, what would you say?
Well, my role is to help with just retinal disease. The retina only has a finite time that it can tolerate dysfunction or deterioration, so I need to get in, you know, early. And so that's why it's so important to be screened. And then the retina is just this delicate, amazing structure, which we'll get into later. But it's my passion. I love talking about it. And we can just help keep that tissue going like never before.
All right, before we go, I have to ask this one last question though. So you could have a retina issue and not necessarily go blind, but have, right? Like,
correct.
But have major issues that you might.
The disease can be silent. You can have a major problem brewing and you're still seeing well.
Oh, okay. So you can still see well.
Right. So that's why I need to be screened. That's why it's so insidious to patients. They don't realize they need to be seen. If you're diabetic every year, if you're older than 50, you should be screened for macular degeneration. All
right. Well, always a pleasure hanging out with you, Dr. Johnson. Thanks again for having us. And for more information, head online to retinacharleston.com. More Living Locals coming your way. Stay tuned. We'll be right back.